Let's focus on how we stage PID and the management of PID. So we'll start with, firstly, the name of the system is the Gainesville system. That's the staging system we use for pelvic inflammatory disease. Let's start with stage 1. So stage 1 is described as early salpingitis. So the woman will be tender, she'll be apyrexial, she won't have any pelvic peritonitis or any other systemic complaints associated with the PID. And the goal here is to treat her and to take away her symptoms. It can be done at home with oral antibiotics, although she does need to be followed up in 2 or 3 days. Then stage 2 is described as late salpingitis. So in this stage, there's pelvic peritonitis, so you will elicit CET, cervical excitation tenderness, on examination, and the patient will be pyrexial and may feel unwell generally. The goal of treatment here is to save the tube to hopefully prevent tubal damage that could result in infertility or ectopic pregnancies down the line. And the treatment for stage 2 is to admit her to hospital, oral and IV antibiotics. And I'm going to speak a little bit later about why we give oral and IV antibiotics to these patients. Stage 3 is defined as PID with a tubo-ovarian complex. And the goal of treatment here is to save the ovary, which has now become involved. You'll notice that the treatment is the same as for stage 2, although the patient is much more sick. It's to admit her, oral and IV antibiotics. Stage 4 is when a tubo-ovarian complex has ruptured. Now the patient has generalized peritonitis and she's most likely in shock or soon will be in shock. The goal of treatment is now to save her life. There's a good chance that she's already got severe tubal and ovarian damage. Now the goal is to save her life. And again, the treatment is to admit to hospital, oral and IV antibiotics. For stage 2, 3, and 4, if there is no response to antibiotics after 48 hours, she'll require a laparotomy to clean out pus, and this also might involve removing the tube if necessary, removing the ovary if it's become badly infected or damaged. If a patient is too unwell and it is thought that she will not survive a 48-hour wait for antibiotics to have an effect, then she'll need a laparotomy straight away. Let's talk a little bit more about what is meant by oral and IV antibiotics and why we do that. So this comes back to the pathogenesis that we discussed earlier, where we discussed that they are primary invaders and secondary invaders. So the primary invaders, which are chlamydia, gonorrhea, and anaerobes in most cases, although we discussed that it is polymicrobial and there may be other organisms that are primary invaders, for example, Mycoplasma genitalium. Those primary invaders are treated by azithromycin, ceftriaxone, and metronidazole. Then the secondary invaders, they require an IV regimen of ampicillin, gentamicin, and metronidazole, or an equivalent broad-spectrum IV regimen of drugs. Obviously, you don't need to give metronidazole twice, so if she's taking it IV, you don't need to also give it orally. But this course of oral antibiotics will need to be continued after she's discharged from hospital, normally for 2 weeks. So the 2 different regimens of drugs is to combat all the different organisms that are involved in PID.